Thank you for joining us today. Today's health briefing is the sixth in a series of briefings focused on presenting real-time COVID-19 healthcare data and valuable information specific to vulnerable and at-risk populations in South Central Pennsylvania communities, inclusive of York, Lebanon, Lancaster, Hanover, and Gettysburg. This briefing is presented by Family First Health, a leading regional healthcare organization serving at-risk populations for the past 50 years. Family First Health is a federally qualified healthcare center serving more than 20,000 patients annually. We invite the media and the public to submit questions in the comments section of this video post or in advance of our briefings by emailing healthbriefings@familyfirsthealth.org. Copies of the video briefing will be made available online at familyfirsthealth.org shortly after each briefing. We will begin momentarily.
Welcome to the sixth in a series of community health briefings offered by Family First Health. We started this journey specifically focusing on the experience our patients and our communities were having in the COVID pandemic, and we have expanded these conversations to incorporate issues that are important to our community, to the patients we serve, and today's topic is incredibly relevant to those constituents and to Family First Health as an organization. I'm Jenny Englerth, and I'm the President and CEO of Family First Health. I'm so pleased to be able to share information, and I'm very excited today to have Thais Carrero to join us. Thais, welcome.
Thank you so much for the invitation. Thank you for having me.
Thais is the Program Director for CASA. And Thais, before we jump into our subject today, I'd like you to be able to introduce yourself and tell us a little bit about the mission of CASA and the work that you do in our community.
Absolutely. Well, my name is Thais Carrero, and I'm the Pennsylvania Director for CASA and CASA in Action. CASA's mission is to create a more just society by building power and improving the quality of life in working class Latino and immigrant communities. And we do that with a comprehensive approach, right? Not only providing services to make sure that people's needs are met, but also organizing the community and taking a proactive approach to make sure that we listen to people's concerns to then address the issues that are the roots of those needs. So in addition to our service model, we do the community organizing and a lot of civic engagement work to make sure that folks understand their civic duties and responsibilities as a way to build power and more representation across the board. And then we have a family of organizations that include CASA in Action that is solely dedicated to election engagement and political work.
Well, welcome. Thank you for joining us. And you're the perfect guest for our topic today, which is going to be focused on the current election and implications for our health and the healthcare system. So why is it important to talk about this topic? As I was reflecting on that, I'm consistently drawn back to a data point where that demonstrates that 4 out of 5 of us indicate that we have struggles with health literacy, meaning that we have some trouble navigating the healthcare system in some way, shape, or form. So if we have that low level of health literacy across populations in our country, that leaves us a bit unprepared when we go to the polls if healthcare issues are important to us, and they are to many voters across the country. So our intention of this discussion is to raise awareness of key issues, provide some information and context that may help people improve their health literacy, provide some resources in regards to voting so that we're as prepared as we can be, and also some resources that may help us understand specific candidates and their positions, which is of the utmost importance. So I want to share a slide and get some of your feedback and comments on it. This is information that was put out in September by the Kaiser Family Foundation, and it indicates that these are kind of the top issues for voters as they're going to the polls this election season. So we have the economy, and then we have a new entry to the list of typical issues that are important to people, and that's the coronavirus outbreak, coming in at 20% of registered voters rating this as their second priority when they go to the polls. We have criminal justice and policing, race relations, and then healthcare. Healthcare typically falls in the first, definitely in the top 5. In many elections, we've seen it be in the top 3 issues. And I was curious when I saw this slide that we have this distinction between the coronavirus outbreak and healthcare overall. So first, I wanted to ask you, as you reflect on this list of priorities, how does this align with your members' priorities as they go to the polls this season? Your understanding of that?
I think it's pretty accurate, to be honest. Our members and what we've seen out in the community beyond our members pairs pretty much with that list that you provided. I think that people are thinking about coronavirus as a mix of things, right? Not just the disease and the medical aspect of it, and that's why it's so high in the scale. And I believe it's because of that, because people are experiencing it firsthand and kind of like connecting how a pandemic is affecting every other aspect of their lives. I mean, we've seen very, very hard stories from our members and the community in general that have to do with all these priorities. And as they connect, right, everything that's going on with the pandemic, the economy, healthcare in general, they're connecting those dots to make sure that they go to the polls and take action, right, in whatever direction for the election to take the direction that they want in terms of like being truly represented in government.
Could you share a little bit more specifically about how the pandemic has affected the membership and the communities that you care about?
absolutely. We work primarily with immigrant and Latino communities. Immigrant and Latino communities have it a little bit more difficult, right, to work, to find jobs, to access services in general. And they were, absolutely, and they still are absolutely on the front lines, making sure that, we have food on the table, making sure that our hospitals and medical facilities are clean, making sure that people are taken care of in the hospitals, right? We have a variety of folks in our membership that work across different industries, from like farms to grocery stores to hospitals. And when the pandemic hit, they were the most affected, just like across the country and across the state. They were the most affected in terms of getting the virus, not getting treatment, but being having to be able to go to work, right? So that's why it spread so fast across our communities, because they were the most at risk and they were the less likely to get quality health care, or just the ability to access that health care. A lot of people lost their jobs. A lot of people didn't have anything to eat. We had to come up with a food distribution program, because even though there were a lot of food resources in our area, some folks weren't able to get it. We have a lot of people that don't have driver's licenses because of their immigration status, so they couldn't necessarily drive to the food distribution centers that we had in our area. So we felt like it was necessary to come up with that. At the same time, a lot of people lost their job, lost their main income, and they didn't qualify for any money, like the stimulus check, like any relief packages that the state put together. So we had to come up with a solidarity fund, what we call the solidarity fund, where we had individuals and companies donating to this fund to be able to provide direct cash assistance to immigrant families in our area. I think in York specifically, we're probably up to like 500 families that have received direct cash assistance, no questions asked, just like everybody else got the stimulus check. And this is just what we see. It's not new, right? There are issues that have been there for the longest time, and the coronavirus kind of like magnified. And now everybody is paying attention, right? And with 2020 being such a, I don't even know how to call it, but a special year, right? Pandemic, everything going on, and with the election, right? I always say that if anything good came out of this pandemic, is that it helped connect those dots that I was referencing earlier, because we can truly connect everything that is happening around us, from healthcare access to what's going on in our schools, to what's going on with our businesses, directly to the folks that are in power at all levels, at the city level, at the county level, at the state level, at the federal level. So we've seen a lot, but hopefully this is just more fuel, right, to make people more enthusiastic about getting registered to vote and ultimately going to the polls in November.
Yeah, I would completely agree that this has been a real opportunity for us to connect the concept of the health care that we all may experience as individuals with the policies and structures that frame the care that we receive or we don't receive. And sometimes that's a big leap. The virus and the pandemic have certainly helped fill that gap a bit, while it's created and highlighted others. I want to just remind us from a Family First Health perspective, and I'll share a slide that reminds us kind of the impact of the virus over time on Family First Health's 25,000 patients. If we look, we started testing in March, and you can see through the months, through the kind of initial peak, we had our patients exhibited a 24% positivity rate. That was at times sometimes 3 times higher than the general population's positivity rate in the counties that we serve. And when we look at these numbers decreasing, like we've certainly seen across the region and state and country, I want to continue to emphasize that a majority of the individuals that make up this number are members of the Latino community and members that we've served historically over time. And unfortunately, for all the reasons that Thais so well articulated, found themselves front and center in this pandemic. And we've seen people of color impacted disproportionately across the nation. In our particular region, the Latino population was the hardest hit. That's why it became important early on for Family First Health to offer testing, to think about our clinical capacity, both face-to-face and virtual, making sure that primary care access remained available and continues to remain available for people that need it most. When we think about that spotlight that the coronavirus has really shined on the fractures that existed in our healthcare system, which supported health disparities in all chronic conditions and health conditions overall. We can think about birth outcomes, we can think about rates of diabetes. All of those historically have had a disproportionate impact on people of color, on low-income communities, and this is something that Family First Health is intentional about addressing, and yet we understand that this is a systematic problem. This isn't an individual problem. And so it makes it very difficult. While we can certainly support individuals in improving and maintaining their health, we also have to be working and thinking about the system level. And that's really what drives us to our conversation today. Which is highlighting those issues that should be most important if people are prioritizing health and health issues as they think about going to the polls or evaluating candidates. So let's talk specifically about the issues that are impacting health and front and center in this election. I'd like to start with access. We already talked about kind of those priorities and where those fit, but I want to share with everyone information that was recently released from Families USA, and that shows or demonstrates between March and May of this year, so a really short period of time, 5.4 million American workers lost their insurance, their health insurance or their health care coverage. Kaiser Family Foundation took that a little bit further and said, if 5.4 million workers lost their insurance, what was the extended impact to their families? And when we look at that number, that takes us to 27 million Americans in the course of 90 days-ish lost access to healthcare coverage. So that is one of the pandemics inside the current pandemic that we are highlighting. And I also want to emphasize that that's 40% higher than the highest previous increase, which occurred over a much longer period of time, almost 18 months in 2008, 2009, when a large number of people due to the recession lost health insurance coverage. So this is a substantial crisis that we're really sitting in the middle of that sometimes gets buried or overlooked by some of the immediacy of the current pandemic. So when you think about access and affordability and insurance coverage, which we believe at Family First Health is really foundational to good health. Having a health insurance card doesn't in and of itself guarantee good health, but it is essential and foundational to a person being able to achieve good health over time. So when you think about your members and the communities that you serve, what is top of mind around insurance and affordability in their journey to good health and accessing healthcare?
I mean, I think that it's time, right? And we're talking about it in our community meetings, as people face, and interact with the health system. The fact that health insurance is employer-based, we have to start rethinking that, right? Because something like this could happen, and all of a sudden you have millions of people without health insurance. And if we really believe that health is a right, if we really believe as healthcare as a right, we definitely have to start thinking about How can we ensure that everybody has access to affordable quality healthcare? And maybe employer-based insurance is not the answer to that. It doesn't mean that it's going to change overnight, right? But we have to start working and building on what we have to make sure that in the not so distant future, everybody, regardless of the color of the skin, regardless of their employment status, regardless of their immigration status, have access to quality and affordable healthcare. When I think about the immigrant community that we serve, many of them don't have the privilege to even have employer-based insurance, even though they are working, legitimately and paying taxes to the IRS just like every other legal permanent resident or U.S. citizen, right? So I think that as we move forward and thinking this election in particular, that is something that is top priority for our members and the community in general, as we are seeing and reading across the board.
So what's at stake? Another front and center issue is thinking about the provisions, particularly key provisions of the Affordable Care Act that may be heard by the Supreme Court later this year, or will be heard, and they have a variety of options in their decisions. So when you think about those key provisions around the individual mandate, like coverage for pre-existing conditions, the ability to provide coverage to a dependent. And again, I want to point out much of this is also intertwined with employer-based insurance, and you just talked about some of the challenges overall with that. But what are those implications if some of those key provisions are removed from your perspective?
I mean, I think that we can anticipate that the hardest effects are going to be seen in communities of color. Just like we have seen with the pandemic, right? Folks of color are more prone to having these pre-existing conditions and are often the ones that get less care. So if now we get those provisions removed, it's just going to mean no health care for a lot of communities of color, which it's just going to perpetuate what's been happening for many years, that communities of color and poor communities have less access to healthcare, quality and affordable healthcare, which in turn just translates into more expensive healthcare, right? If we take a more proactive approach, not only communities are going to be served better, but it's just better for the economy.
Yeah, I think that connection, my husband often reminds me his work is in economic development in part, and he's a great reminder that a strong economy doesn't exist without healthy people. And so when I think back to that ranking that we showed when we started talking about what issues are most important to voters, there's a strong tie between all of them, but I would particularly highlight the tie between economic prosperity and opportunity and the access to health and health care. I also want to underscore that as a healthcare provider, these issues are extremely important to us, and we also always think beyond our walls. Health for all of us, it's imperative for us to have access to healthcare providers when we need them. It's also imperative that we live in healthy communities and that we understand, I want to emphasize that we understand as healthcare providers, we are one piece to the puzzle. While we may be an important piece, things like opportunities for jobs, economic prosperity, safe schools, safe neighborhoods, fresh food, all of those things are what make each of us either healthy or deter from our ability to maintain our health. And if we really think about all of the provisions of the Affordable Care Act, which were many, and certainly not all of them applicable to the Supreme Court case, it really did take a very broad lens and look at those things that, or attempted to, that make communities healthy over time. I want to shift a bit to Medicaid. So Medicaid is a public coverage option. It's funded by both the state and federal government. And for Family First Health, it's vital to at least 10,000 of our patients. And so it's something that I keep an eye on and try to be very in tune with. And when I think about those 10,000 patients, a majority of those are children. So just to be clear about who Medicaid serves and the intention of that program. When you think about your membership, how important is maintaining, if not enhancing at this point in time, the Medicaid program?
I mean, it's crucial. I've had families, right, talk to me about it doesn't matter if I have insurance as long as my kid has insurance, right? It's crucial, right? We have a lot of folks. We know that our communities don't necessarily have, well-paying jobs if they're making minimum wage, which is also another issue that is driving our folks to the polls. So having an option, a public option to make sure that their kids at least have that access to good healthcare is crucial, and it's absolutely something that is driving folks to the polls, especially with the issue of the pandemic that we're living right now. It's just, I really believe that 2020 is a year that folks are taking like a more proactive approach and realize the power that is in one vote, right? A lot of folks are not necessarily used to thinking that one vote means something, right? But as we see how our communities are being affected across the board, in our state and across the nation, it's just highlighting those issues that we really need to take action on.
So let's shift a little bit and talk specifically about voting. I've voted in every election that I had the ability to since the age of 18, and I've never had to make a plan to vote. So I think it's important that we devote a few minutes to talking about some of the key elements of that plan. And I just want to emphasize that we're needing to make a plan this year for voting, like we've needed to make a plan for things we never thought we'd need to make a plan for. I never made a plan to go to the grocery store before March. I never made a plan to, manage other aspects of my life. So this is really driven by the pandemic, and we need to understand that this is another element of our lives that we need to make a plan about. So we were able to partner, CASA and Family First Health, to help get information, answer questions, help people register to vote. And we were so grateful for that opportunity. And so many of our community residents, patients, and staff took advantage of interacting with your team. And so run down for us, and this was all about making a plan. So run down for us those key elements of what we need to be thinking for as we're planning to make sure we cast our vote this season.
I mean, first of all, research your candidates, right? Research your candidates after registering to vote. Registering to vote, the deadline is actually on October 19th. So you still have a couple, if you're watching and you're not registered to vote, you still have an opportunity to do so until October 19th. Research your candidates. There are a lot of resources online, including our sister organization, CASA in Action's website, casainaction.org, to see where the candidates stand in terms of, a variety of issues. Register to vote, and then select how are you going to vote. In Pennsylvania, for the first time, we did a practice round for the primary, and now we finally are figuring it out, the mail-in ballots. This is an opportunity to vote from the comfort of your home. You have until October 27th to request a mail-in ballot. Once you request it, you can track it online. You can see where it's at. I actually I'm getting mine today. I just saw an email that says your ballot will be delivered today. So I'm really excited about that. You can either return it by mail, or you can either drop it off at the Board of Elections office. But regardless, if you want to vote in person, you can do that too. With the pandemic, there are additional precautions that we need to take, right? Like wearing a mask, hand sanitizer, and I'm sure all the polling locations will be prepared for that. But in terms of the plan, you need to make sure that you talk to your employer if you work, to make sure that you have the opportunity to cast a vote, right? Make sure that you know where your polling location is. Right now, we've had some changes, some that are regular, some that happen because of the pandemic, and the Board of Elections wants to prevent long lines. So make sure that you know where your polling place is. And make sure you have a ride. If you don't have a ride and your polling location is not at a walkable distance, there are several resources that you can tap into to make sure that you have a ride. And then when you are casting your vote, if you have any issues, if you think that you're not being treated well, that there's you get some issues with your with casting your vote, you have any issues at your polling location, there are voter protection efforts going on by a variety of organizations, including CASA. So make sure that you know where your location is, that you have a ride, and then you have set a time to go and vote. And regardless of your plan, whether it's by mail or in person, it's important that you execute that right and that privilege that for so many is a privilege to vote, because it's the only way, right, that we can take proactive action to make sure that we're truly represented, and that the people that we decide to put in power truly represent our interests. I think it's important to mention that with the mail-in ballots coming up this November, the Board of Elections is not necessarily able to start counting those ballots until 8 p.m. The day of the election, and we've had thousands of voters requested mail-in ballots. So it's important to know that regardless if we know the result of the election on November 3rd or not, our votes will be counted, and organizations like CASA are going to be there to make sure that happens, right? That every vote, regardless if it was made in person or by mail, is counted. So voting it's a civic duty, right? It's our responsibility. So I encourage everybody to take action, to make a plan, and vote on November 3rd.
Absolutely. I would second that. I'm always distressed when I see the numbers of folks who are eligible voters who haven't voted in any election. This is our time to make sure that we're able to have our voice be heard, and having good voter turnout is critical to that. And you've given us a lot of good tips of things to think about. We have time yet to register. We have time yet to request mail-in ballots if that's something that we're interested in. And we certainly have time to make a plan to go to the polls in person to cast our vote. So in closing, I'd like to share personally we talked about that priority list from Kaiser Family Foundation. And certainly while healthcare is an important issue to me, to my family, I also am driven to the polls each year or each time that I'm able to vote by issues that are related to education. And access to education, equity in education, and ensuring that a quality education is on the top of mind for the candidates that I support. I wanted to give you the opportunity, Thais, to share what motivates you as your ballot comes to you today. What will those issues that you've been evaluating candidates on, what's top of mind for you?
Oh, there's a lot. There is a lot, but education is absolutely at the top of my list. Jobs are at the top of my list, and immigration on the top of my list. Seeing firsthand how this pandemic affected our immigrant communities here at home, right in our backyard, they're our neighbors, right. Has had a really big impact in my life, right? Not only in my job, but in my personal life as well. And understanding the hardships that the immigrant community faces when it comes to all those issues, education, healthcare. It's certainly something that is driving me. I am not, I'm privileged, right? I'm a native Puerto Rican, so I was born a U.S. citizen, and I'm privileged, and I understand that privilege. And what I want to do with it is try to, use my privilege to bring the communities that have been left behind, and my neighbors pretty much, to the forefront, to make sure that not only their issues are in the forefront, but that they understand that they have the power to stand up and speak up, because their voice matters, right? Regardless of their immigration status, they're human beings, and that is what's driving me to the polls this November.
Thank you for sharing that. I appreciate it. And I appreciate your time, your expertise, the work of CASA and all your team members. As we close this health briefing, please note that there'll be information on Family First Health's website, familyfirsthealth.org, that will not only provide more detailed information about our continued experiencing managing the COVID pandemic, but also resources about CASA in action, and some of the more specifics or links to the voting resources that we've talked about today. Please, there's time, please go cast your vote, and please think deeply about those issues that matter to you and your family, and particularly healthcare issues. Our individual and community health drives and supports a healthy economy for all of us. And our candidates certainly have strong positions about health and healthcare, so please take the time to find out what they are. Thank you again, Thais. Thank you for joining us, and thanks to everyone for joining us today. Thank you.
Thank you, Jenny.